Welcome to the HubLE talk entitled Muscle-Bone Crosstalk in Burn Injury. I am Gordon Klein at the University of Texas. By way of introduction, severe burn injury gives rise to systemic, inflammatory, and acute stress responses. The immediate consequences include acute resorptive bone loss and muscle wasting. Bone resorption, as shown in this backscatter scanning electron micrograph of an iliac crest, courtesy of Dr. Linda Bonewald, begins on day 1 post-burn and is histologically apparent by day 5. Notice the scalloping in the upper panel that is pathognomonic for resorption. The next slide depicts the results of the randomized double-blind controlled trial of a single dose of the bisphosphonate pamidronate given intravenously within 10 days of burn injury. Drug-treated burn patients preserved their bone mass for at least 2 years. The next slide shows stable isotope studies from patients in the bisphosphonate trial examining muscle protein balance. Muscle protein degradation was reduced and muscle protein net balance was positive in burn patients. These results are shown on the left and the right respectively. The patients who were positive in muscle protein balance were treated with the single dose of bisphosphonate. To understand how this happened, I collaborated with Linda Bonewald's lab at Indiana University to provide serum from burn patients and normals. These were patients who were either in the bisphosphonate randomized controlled trial or a set of matched normals. The serum samples were cultured with murine C2-C12 myoblasts, and the resulting myotube diameters were compared. This slide shows the difference in myotube diameters between normals, designated as N, burns treated with standard of care, and placebo, designated as B, and burns given bisphosphonate as B plus P. The differences are better illustrated in the following slide, showing graphs in 1% serum and 5% serum on the left and the right respectively. These graphs demonstrate partial rescue of myotube diameter with B plus P serum. Western blotting, not shown, demonstrated that serum from B plus P patients rescued phosphorylation of the AKT-mTOR anabolic pathway while suppressing ubiquitin, which is involved in the ubiquitin ligase catabolic pathway. Repeating the myoblast culture experiment, but with adding anti-TGF-beta antibody to the culture, control plus antibody myotubes were rescued to the same magnitude as B plus P serum. Anti-TGF-beta antibody cultured with B plus P serum resulted in no greater rescue than with B plus P alone. To conclude, as shown on the next slide, bone resorption liberates TGF-beta as it does in breast cancer metastases to bone. In burns, TGF-beta upregulates ubiquitin-associated muscle catabolism and suppresses phosphorylation of the AKT-mTOR anabolic pathway. These changes are blocked by bisphosphonate treatment. The final slide includes acknowledgments and pertinent references that have been published. I have no other disclosures. Thank you very much for your attention.